There were two voices calling out, does anyone know CPR? And they were going to, the various cubes on the floor.
Spencer Simpson recalls a day at Books A Million corporate offices, June 7, 2011. Executive Doug Markham had suffered cardiac arrest. Simpson and two others spent 13 frantic minutes performing CPR.
I was very fortunate that I had some fellow associates that knew how to perform CPR, that they started immediately. They kept it going until the EMS arrived.
Markham is one of the lucky few. He lived to attend a celebration of survivors thrown by UAB's ROC, the Resuscitation Outcomes Consortium, a federally funded research effort in 10 U.S. and Canadian cities to find ways to improve cardiac arrest survival.
Cardiac arrest is a major public health problem in the United States. It affects over 300,000 individuals each year, and survival remains dismal, on the order of 5 to 6%.
The greater Birmingham survival rate has doubled since the ROC studies began, from 3% to 6%.
Cardiac arrest survival requires bringing together a perfect storm of multiple elements in healthcare. So not only is it important how EMS provides care to the patient, but we need to join that with excellent CPR provided by bystanders, early activation of the 911 system, and then after the heart is restarted, how the patient is cared for in the hospital, post-arrest care, is also extremely important.
Wang says information gleaned from the ROC studies has helped to enhance EMS response, and many hospitals have also improved post-arrest care by following UAB's lead in introducing therapeutic hypothermia, a new technique to prevent brain damage associated with cardiac arrest. CPR, on the other hand.
One of our big missing ingredients in Birmingham is the poor rate of bystander CPR. We know that from our ROC's information in Birmingham, only 15% of our cardiac arrests in the greater Birmingham area receive bystander CPR. In Seattle and other communities, it's over 50%.
Spencer Simpson never expected to be called upon as he was. He took his first CPR class just a few months before Markham's collapse, as a precaution prior to the birth of his daughter.
I had a good reason to learn it, but I without realizing that I would have a really great reason, a really, really important reason to learn it.
The irony of it all is that I've known it for 40 plus years, since I was a boy, and never had the opportunity to use it. And then one of the people working on me had just learned it within a few months for the first time. So if it hadn't have been for those fellow associates that knew CPR, I wouldn't be sitting here today.